All right, I think that we have a pretty good crowd here, so I think we're going to get started, and we might have some latecomers, but that's okay. So first, I'm going to say welcome and thank you for attending tonight, taking your time out of your night. I know everyone has a busy schedule, and tonight we're going to talk a little bit about preparing for a kidney transplant. And the purpose of today is to give you just an overview of the kidney transplant process. And while we definitely encourage you to ask questions and want you to ask questions, there are some that are appropriate for us to answer, and there are some that are going to be more appropriate for a doctor to answer. So I just want you to be aware of that all questions are welcome, but whether or not we can answer it, I hope that we can, but we'll see. Also, just some housekeeping things. To the right, you should see a nice little bar there, and there should be a little chat function. If you want to ask a question during the presentation, you can type your question in there, and I will do my best to address it during the presentation. And then at the end, I think I'll unmute everybody, and we can do a little more interaction and everything like that. I just want to make sure we get through all the slides. So let's get started. So here we see NephCure's focus. This is not yet our official mission statement, but this is kind of our mission statement in plain English for everyone to understand. So by engaging a broader community, NephCure Kidney International, that's us, seeks to raise and leverage support to expedite treatments and a cure for nephrotic syndrome and FSGS. And today, I just want to point out that you are the community that we are hoping to leverage support from and serve. And by doing this and by being here, you are empowering yourself and through education. And I want to thank you for that, because that is one of the best ways that we can raise support and raise leverage to expedite treatments and a better cure. So thank you again for being here tonight. So let's get right into talking about transplants. Here we're going to see the stages of chronic kidney disease, and I apologize that this picture is a little fuzzy, but however, it's probably one of my favorites. It's from the National Kidney Foundation, and I like it because you can clearly see the stage, you can see the glomerular filtration rate, the description, and the action plan all in one, and it's all in very good plain English, so everyone can understand it, I can understand it, I can speak to it. So again, this is just my favorite. It's a little blurry. Sorry about that. So here we see stages 1, 2, 3, 4, and 5 of CKD, and we're really focused today on stages 4 and 5. So you look at stage 4 and over to the clinical action plan, you see preparation for kidney replacement therapy, and that's really when you're going to start thinking about your kidney transplant. In stage 5, as you're into kidney failure, that's really when it's more of an option, more of a necessity, really going to have the talk there seriously in stage 4, and then really more kind of urgent in stage 5. So let's talk a little bit about where you're going to be at that point. According to the Beth Israel Deaconess Medical Center at Harvard University, patients that receive a kidney transplant live an average of 10 to 15 years longer than if they stayed on dialysis. So if you're at this stage in your kidney journey, you're really making a decision at this point. While dialysis is great and it is extremely life-saving and it can really, help some people live a long, fulfilling life, there is some data out there showing that transplant, is a very good option as well. And for some people, it might be the better option. And since everyone is here, I'm quite sure that, obviously you're thinking about transplant in some sort of way. So dialysis is life-saving. Other health concerns can arise, and it doesn't replace full kidney function. With a transplant, you're going to get a little bit closer to that full kidney function that we are looking for. And most patients who have been on dialysis and then a transplant report much better life afterwards. It is like a new lease on life is kind of how it's been described to me. More energy, fewer complications. A lot of people are able to return to work, which means a lot in your day-to-day life. You get a lot more independence back, and everyone just really enjoys that part of it. So once you're getting the transplant talk, once you're making those decisions and that is the way that you're going to go, and the transplant is kind of green-lighted almost, you're going to start with your test. And when I say test, I mean a lot of testing. I have a big laundry list here, and I'm just going to rapid read through them. So here's the kind of test that you have to get. A physical, chest x-ray, EKG, blood test, blood typing, checking your lungs, checking your GI tract, check your kidneys, of course, viral testing, a mammogram and a pap smear if appropriate, dental evaluations, that's the one that surprised me the most. You know, they need to look at your teeth. The bottom line here is that they want to look at your overall health, and this is going to help place you on the list. This is going to help determine how the surgery is going to go, how well that everything is going to be for you. And while it might seem like a lot, it is all worth it in the end. So one thing I did want to point out and talk to you about, one of the most important thing is the histocompatibility and the blood typing. And here we have the chart down here because it gets really confusing and really hard to keep track of this. So if you have blood type O, you can receive a kidney from a donor with the same blood type O. However, if you are type O, you can donate to O, A, B, AB. Very confusing. If you have A, you can receive from A or O. So what you're seeing here is that O is a universal donor, but it is not a universal recipient. So donor and recipient is not always a two-way street. There's one or the other, okay? So B, you can receive from B or type O, and AB you can receive from O, A, B, or AB. So here we see AB is the universal recipient, O is the universal donor, and A and B are a little more type specific. So that always gets confusing. Definitely something important, just something to have in the back of your mind. Obviously, the hospitals will all check this out. It's not a worry for you, just a fun fact and a good piece of information to have when you're looking for donors or looking even for blood transfusions. So now let's talk a little bit about the transplant list. Once you get through all that testing, then what happens? So we have UNOS here, which stands for United Network for Organ Sharing. And we're going to go to their website just really quick, see what's going on with them. So they are a private nonprofit organization, manage the nation's organ transplant system under contract with the federal government. So it's very important that this is all regulated. They're a nonprofit, which kind of makes me feel good, but they are regulated by the federal government. They are managing the wait list 24 hours a day, 365. That's very important because it can come up at any time, the possibility for an organ transplant. They manage the database. So they have all the statistics on transplants. They know who got whose organ. They're very in touch with all of that. And their website is a good resource if you want to learn a little more about the list and things like that. You can check them out, unos.org. Okay? So the list, really the purpose of it is they want to ensure fairness in transplantation. So the list is managed by doctors, social workers, everything, psychologists. And what they want is they want to make sure that there's fairness in transplantation. They want as much success as possible. Basically, they want to make sure that kidneys go to people who are going to receive them well, who are going to be healthy, live healthy lives after and before. Also, I want to point out here, there is living donor versus deceased donor. You can be on the transplant list and looking for a living donor, but you're usually only going to look for one living donor at a time. And then if you have a donor lined up, you're probably still going to go on the list, again, because they need all of that data. That's kind of their responsibility. They're really in tune with all of that. But you will go on the list and you'll be inactive and you're going to accrue some time. It's going to go on there, so on and so forth. The list is kind of confusing. The doctors and the people who actually manage the list are much better experts on it than me. I was hoping just to give you a quick overview. So moving on from the list, because it is a confusing and not always fun thing to talk about, let's talk a little bit more about leading up to the surgery. One of the most important things that you can do is keep yourself as healthy as possible, both physically and emotionally. And during this whole process, there are going to be a lot of emotions, and that is okay. That happens. It's fine. You're going to feel anxious, irritated. You're going to feel so happy and relieved that this is happening and that you're going to get a new lease on life. And this is all going to happen within maybe 24 hours. It is a roller coaster ride. It is very stressful, and it is okay. But the thing is you need to make sure that you have a support system, that you have people that you're talking to. You just need that support both mentally and physically. I want to mention here, you should still be taking your meds or going on dialysis while you're waiting for your transplant. You need to be as healthy as possible to go into a major surgery. You really just need to be strong and be able to accept this and get through it, because it is a pretty major surgery. So I want to talk a little bit about the phone call for deceased donors if you are on the list. A lot of people might, live their life waiting for this phone call, just sitting, staring at the phone. And I want to remind you that while it is very important to be accessible at all times, you should not live your life like that. You should still be living a healthy, fulfilling life. Again, and that goes with keeping yourself healthy, emotionally and psychologically, that, you're not just sitting around not wasting time, but, just waiting and not living your life the way that you should. So, moral of this story is to take care of yourself physically, mentally, emotionally, and have a good support system. So finally, we're moving on to the surgery. So let's talk about your team. You're going to have a nice big team, which should make you feel good, because they are all going to have one thing in common, and that is you and your transplanted kidney. So you're going to have a surgeon, a nephrologist, which is usually your own nephrologist that you should be comfortable with, the transplant coordinator, nurse, maybe one or more, the psychologist or psychiatrist. Again, because there are so many emotions going on with this, they need to make sure that you are understanding. And I'm really harping on the emotional part, but from what I've heard from a lot of people, that is the one thing that surprised them the most, is how many emotions and how emotional they got throughout this whole process. So I'm bringing this up to you so that you would be less surprised, more prepared to deal with it, and that this can go as smoothly as possible for you as you approach your kidney journey. Again, there's going to be a social worker, a financial coordinator, standard for all, big hospital issues, big hospital procedures, and then a pharmacist who can help you talk about through your meds and the anti-rejection meds, and we're going to get to that a little later. So let's talk about the surgery some. So the day of, or maybe before, you're going to be admitted to the hospital. They're going to do all the tests on you, check your blood, heart rate, blood pressure, all of the standard things just to see how you're doing. And once that all checks out, you will be prepped for surgery. And then placed under anesthesia, a general anesthesia. You won't remember anything. You'll be out. And then the actual surgery itself, I put this in because I find it fascinating. I love the science of it. So they take the kidney out, put your new kidney in the abdomen, connect your blood vessels, and then connect the ureter to your bladder. The whole thing takes about 3 hours. And I just want to mention that is an average. Could be more, could be less, depends on where you are, what your situation is, but that's about the average that I've seen. And after surgery and during, you will be very closely monitored, and your kidney should begin working pretty much immediately as soon as the surgery is completed, everything's connected, ready to go. And again, I got to bring up the emotional part. This is when you're really going to feel a whole rush of emotions, because at this point you have a new lease on life. You had a kidney that was not working, basically done, not doing its job at all. And all of a sudden you have this whole new set of independence and this whole new sense that my body is working, something is working, this is happening, my health is going to get better. And again, people just describe it as a whole new lease on life, and it is very elating and very, just a very big moment. So post-transplant, you are going to be in the ICU, which is where you get closely monitored. They take blood pressure, I think every 15 minutes is the standard or something like that. And the next thing is that they're going to be taking all precautions possible to eliminate contact with any germs at all. Because at that point, you're going to be on a lot of immunosuppressants so that your body does not reject the kidney. So what would happen is that your body is detecting something foreign, something that is not your own tissue, and it might start attacking it. At this point, that's where the immunosuppressants come in. They calm down the immune system and keep it from attacking that kidney and making sure that it is, being accepted by your body. And at this point, they are going to be taking labs constantly to make sure that the kidney is working, to make sure everything looks good, post-op, pretty standard. Again, I got to bring it up, new emotions and new worries. We're going to talk about that a little more. And then we talked a little bit about the anti-rejection protocol and about the immunosuppressants. So it is very important that right away that there is an anti-rejection protocol in place. And each center is a little different. Some are moving away from this standard steroid anti-rejection protocol with some other medicines with long names that I can hardly pronounce, let alone remember off the top of my head. But each center is a little different, and that is something that you should talk to your team about before. If you have any concerns about what the anti-rejection protocol will be, that's definitely something to bring up before surgery. Finally, if you are interested, you are able to donate your old kidney to research, which of course I'm a huge component for because, that's why we are here. We need to find out more. And again, if that's something you're interested in, talk to your transplant team before that. And I think UNOS can help you do that as well, donating your kidney to research. Very good cause. So post-transplant, we talked about all the new worries that's coming up. Let's talk about the most common concern that I hear, especially from NephCure's patient population, and that's going to be recurrence. And to be completely honest, it can happen. It can happen hours, days, months, years after. There's no telling. There's really, at this point, no way of a good way of knowing. Let's say that. However, and I have this bold, italicized, underlined for a very good reason, this does not mean that the transplant was for naught. This does not mean that anybody's time was wasted, any kidneys were wasted. This is still a new lease on life for you. And the good news is that if you're recurring when you are so closely monitored because you have a transplant that they're going to catch it very early and treatment is going to start right away. And this is going to help preserve your kidney function longer. And it is entirely 100% possible to have a transplant and then recur and then to live a completely normal life with treatment, of course. And I know several cases of that happening, and I hope that that inspires you a little bit and takes some of that worry away. And I do know it is a common concern. I hear it a lot. So I just want to reiterate, recurrence can happen, but it is okay. You can still live a wonderful life post-transplant. You can still have a very good functioning kidney for a very long time post-transplant. So we talk about being alone in our journey, and it is hard because, it is a rare disease and we might be spread out, but I want you to know that you are not alone. In the NephCure Kidney Network, which comprises of over 350 people, roughly 10%, it's actually a little bit over 10% of participants have had kidney transplant. Of those 10% that have had a transplant, 80% report good functioning kidney levels, good functioning kidneys at this point. They are living full, healthy lives at this point in their kidney journey. And of those 10% of participants that had transplant, 73% came from living donors. And I thought that was just an interesting fact. And another interesting fact was that the average age of a transplant recipient was 24.2 years old. And I do want to point out that this is from the NephCure Kidney Network. This might not reflect the national average. We absolutely hope that it does, but we're getting there. So I want to say that if you're approaching transplant, if you had one, that you should please tell us. Tell us in the NephCure Kidney Network. It is very important, and we're going to talk a little bit more about the NephCure Kidney Network because really what is it? It is a patient survey that we can use to help advance research. So after you consent, you answer a nice long 100+ questions about your health, your family, your patient-reported outcomes, which is extremely important because that asks you how you feel every day, which isn't always included in research studies. And I want to note that it's a lot of questions, but you don't have to do it all at one time. You can take a break and come back. And why should you join the NephCure Kidney Network? Even if you've had a transplant, we want your data. We want you to join the global fight. We want you to be heard. Pre-transplant, post-transplant, we want you to be heard. Most importantly is that the NephCure Kidney Network, we're hoping to use the data to help advance research and find cures. We can use the data to look through the trends and the patterns that are happening. And finally, you can be notified of clinical trials. And believe it or not, post-transplant, there are clinical trials available. There are some that they just want genetic testing. They just want to hear about what's going on. So if you have any questions about the NKN, contact Joanna Dauber. Her information is right there on the right of the slide, J. Dauber at NephCure, and her extension is 36. So at this point, I'm just going to give you a summary. I feel like I threw a lot of information at you, and I would love to start to get some collaboration, hear what everyone else has to say. Again, this is my top bullet, of course. You're going to be so sick of hearing this, but the transplant process is a very emotional journey. It's a roller coaster. You're going to be up, down, all over the place, and that is completely and utterly okay. Pre-transplant, you remember to keep yourself healthy, keep on your meds, on your dialysis, whatever you are doing, and also keep healthy mentally and physically, or mentally and psychologically, not physically, sorry. The surgery itself lasts about 3 hours on average, and you will be constantly monitored afterwards. Post-transplant, you can bring new emotions, new worries, again, back to the emotions, but you can and you will lead an extremely fulfilling life. And finally, I have to ask you, please tell us about your transplant journey and your whole kidney journey in the NephCure Kidney Network. That is nephcurekidneynetwork.org. All right, so here's some other resources, and I realize that it's kind of unhelpful because I put the whole long link on there. But what I'm going to do is I'm going to leave this up, and that way if there's any that you think that you want to write down, you have enough time. And at this point, I'm going to unmute everyone, and then I want everyone ask some questions. So make sure that you unmute yourself, because I know some people mute themselves as well. And you can always type questions in on the side too. Everyone there, can you hear me? You want to do a test? I hear some background noise. If we don't have any questions, we can do some introductions. If you're interested, I'll just call out your name, and if you want to tell us a little bit about yourself, if you don't, you can just not talk to me. That's fine. So let me see who's up top here. Kelly, why don't you go first? Kelly, are you there?
Hi, yes, I'm here. My name is Kelly Helm, and I am the manager of patient engagement for NephCure Kidney International. I also have a 9-year-old daughter, Macy, who is about almost 4 years post-transplant with recurrent FSGS.
Awesome, thank you. So if you have questions for Kelly, she's a very great resource because she's a patient parent that has lived through this. Who else? Bill, do you want to tell us a little bit about yourself and where you are in your kidney journey?
Okay, my name's Bill Murray. I was diagnosed with IgA nephropathy in 1996. Just went end stage July of this year. I'm on PD dialysis. Looking forward to getting a transplant. One thing I wanted to clarify that you said, I've talked to several surgeons, they will not, the only time that they remove an existing kidney is if it's normally if it's polycystic. If it's not, they will not, because of the extensive surgery involved in getting to the location of it. They usually will not remove it for any reason.
Oh, interesting. Okay. Thanks.
The only time you get a chance to donate them is after your world is done.
No. Well, thank you. Thank you so much. So now that you mention it, I did use PKD because they have wonderful transplant stuff. So maybe that is why that I use PKD a lot in my research, because they have wonderful transplant info.
I know several people that have had PKD, and their kidneys can range anywhere from 15 to 20 to 23 pounds.
Oh yeah, it's crazy.
So
A lot of time.
That's why they remove those.
Mm-hmm. Go ahead, Kel.
Yeah, and I wanted to mention also, depending on who else is on the line, I think nephrectomy is more common in the pediatric realm for some reason. A lot based on the fact that they cannot control the proteinuria, and sometimes that's the only way to stop
it in
order to proceed to transplant.
Yeah. So I did see here,
It's generally done.
Go ahead.
Proceeding transplant.
I did see
Oh,
here
go
Manu
ahead.
sent in that about 10 to 15% of kidney transplant recipients have their native kidneys removed for one reason or another, infection, stones, size. So again, what we were saying, it can go either way, it looks like. Cynthia, why don't you go ahead and introduce yourself if you want to? Cynthia, can you hear me? Okay, she might. We'll just skip. Manu, do you want to introduce yourself?
Sure, this is the first time I'm doing it on computer. Can you hear
Yeah,
me?
I can hear you. All good.
Yes.
Excuse me. So, okay, this is good. Okay. My name's Manu Varma. I had a kidney transplant myself about 15 years ago, so have an interest in the topic just from living it for quite a while. That's my brief intro.
Thanks, Manu. Jennifer, did you want to introduce yourself? Jennifer, can you hear me? Oh, she has herself muted too. Jennifer, you are muted if you want to unmute yourself. That's okay. So we did have some other people get a little shy towards the end and jump off. It happens. But do we have any other questions, any other concerns, any dialogue that wants to go on? If not, I'm going to leave this up here. This has the Department of Education and Engagement. This is our contact info. I am Chelsea Fix. I don't know if I introduced myself. That was probably horrible of me. My name is Chelsea Fix. I'm with the Department of Education and Engagement. Kelly Helm did a good job of introducing herself. Here's her email. And Lauren Lee, who is our director, and she is a lovely woman and would love to talk to you if you have any ideas, any ways to get engaged or educated. You can talk to Lauren or you can talk to any of us. We're always there for you. So thank you all for attending. If you have any questions, I'm going to hang out and Kelly can hang out too. Again, you can type your questions to me if you don't want to say them out loud, or you can email us later, or we're here to talk to you. So thank you all and have a nice night.
Thank you, Chelsea.
Kelly, was there anything that you wanted to add?
I don't think so. You did a really good job. So I'm happy to answer questions if anybody has them. And there's everybody's off except for Manu.
Hi, Manu.
Okay, all set?
Yep, all good to go.
Okay, have a good night
Thanks,
then.
you too. What did you think, Manu?
No, I thought it was great. I hopped in about 3 minutes late. Was
Yeah,
on another phone
that's
call.
okay.
Seems great, seems fine.